Just hold on.
I think it's recording now.
Really?
Yeah,
Hello
I can see you
everyone.
now.
Thanks. Hello everyone. Thank you so much for helping in. It's a great pleasure to have you here. My name is Ransom Minyema. I'm a medical student in medical radiography med school in Nigeria. And apart from my studies, I'm also a medical content writer. I do a lot of writing for a couple of healthcare companies and personal clients out there. So today, all med talks with Dr. Sophie. Hey, Dr. Sophie, could you introduce yourself to the audience?
Hi everyone, my name is Chiamaka Sophie Njoku. I'm a medical doctor working in the NHS, specifically a psychiatry doctor. Also spent some time in ED as well. It's nice to meet you all.
Amazing, amazing, amazing. So, could you talk us through about your journey thus far as a medical doctor and also, a content creator?
Okay, that's a broad question. Um, Journey as a medical doctor. Well, I graduated medical school 2016, so that's about 7.5 years ago. But I did not go straight into the clinical practice. So I did a couple of other things. I had bits of education, dabbled into research, did a few things here and there, but then went back into foundation training in 2011, 20, something, so like 3 years ago, something like that. And yeah, that's how the journey has been so far. In terms of content creation, I started off with an Instagram page, another one called Moments with Soap, but I've since left that. Did a bit of YouTube as well, but again, I've left that, and I think I'm now more focused on Instagram with my new channel and my new page, Dr. Sophie N.
Okay, I'm a bit confused here. Are you a doctor with two specializations? Like I could see you're an emergency medical doctor and also into psychiatry. Could you explain that first before we go further?
Okay, so I am a psychiatry doctor, but I have a special interest in emergency medicine. So I
Okay.
guess I decided to do that because one, I really love emergency medicine, but also practicing psychiatry in the UK, unfortunately, could put you at risk of getting medically de-skilled. So my working in ED is on my own hours, and I do that to keep up with my medical skill.
No, okay. So what inspired you to pursue a career in both emergency medicine and psychiatry in general? What inspired you?
Simple answer is passion. I love both. So psychiatry in general, I think I've always wanted to be a neuropsychiatrist since 2012, maybe. And I am chasing that dream. But again, I had a rotation in emergency medicine and did not know that I would love it that much. But then again, I realized that the lifestyle of an emergency medicine physician doesn't work for me because it's very stressful. So I decided to blend both worlds, so train in psychiatry, but continue to work in emergency medicine.
Okay. Thank you so much for explaining that first, doctor.
Mhm.
Um, so how do you think your training in emergency medicine, or in psychiatry approach, like how do you think your specialization in emergency and in psychiatry is worth it in the present healthcare economy right now?
Oh, that's a very good question. Um, so I guess to clarify, I am training in psychiatry, but I am not on a defined pathway for training in emergency medicine. But in terms of how do they merge, there is a mental health crisis in the world. It's a global thing. So I think the world needs more psychiatrists, the world needs more people in the mental health sphere. Emergency medicine we would always have emergencies. So having a doctor who is skilled in both, knowing how to deal with the psyche, because I guess research has shown that stress is responsible for quite a lot of pathologies that we see today, or at least a huge risk factor. So having somebody who not just understands the physical aspect of things, but can know how to identify when there's a psychological or a psychiatric aspect to it, or let's say, for example, the effect of stress on your blood pressure or lack of sleep on your productivity, stuff like that. Having somebody who can understand both worlds is very essential because you're not just treating the pathology, but if you do it well, you're able to actually keep your patients um how do I say this? You're able to show them how to make sure that in a way they try and reduce their chance of going back there if they can keep themselves healthy physically, but also keep themselves healthy mentally. They have a good chance of actually trying to stay in good health.
Do you work in hand with pathologists in hospital setting?
No, I do not. I imagine you mean pathology as a specialty. No, I don't work with pathology specialists. No.
Okay, so could you make the audience know what psychiatry and emergency medicine is all about? Before furthermore,
Okay. So psychiatry is the if you become a psychiatrist, that is the title that's given to a qualified medical doctor that has trained in psychiatry. So in the UK we call it training. In some other parts of the world, it's called residency. So when you have gone through medical school, you have gone through an extra amount of years training as a postgraduate doctor, pass all your boards, pass all your exams, you get that qualification, that title as a consultant psychiatrist. So yes, if you're working in psychiatry, you are working with the mental health. So I think working in the UK, it's much more defined. In From my experience in other parts of the world, it's you're a doctor, but there's quite a stratification in the UK. So you have the medics, as we call them, so the physicians, you have the surgeons, you have the GPs, and then you have your psychiatrists. So we specialize on the mental aspect of your health. So thinking about disorders of the mind, thinking about disorders that affect your emotions. So that's our specialty. Like I said, in the UK, it's very, very separated from the rest of medicine. But in a general setting, if you work in emergency medicine, you are dealing with whatever emergency walks through the door. So that could be, for example, someone who was involved in an accident. That could be someone who is having a heart attack, a stroke, somebody who's had an overdose, somebody who's suicidal as well, could all come into your remit in emergency medicine. But generally, emergency medicine is quite broad, and you're dealing with whatever emergency walks through the door, like the name entails.
okay, so thank you for explaining that first. Recently, I was seeing a lot of posts about strikes coming up in the UK about junior doctors, senior doctors earning little, based on their time and work and everything, in general. So, how is the UK healthcare system right now? Is it benefiting for your work as a emergency medical doctor and also a trainee in psychiatry?
I think that's a bit of a political question, so I'm going to put a disclaimer first and say that I am not a DME rep, but
Yeah,
I guess I am a
absolutely.
junior doctor, like you rightly said, and this is something that affects all of us. Um, I think the NHS is in a very sensitive position. Sensitive because obviously we are striking and people don't just wake up to strike. So we're striking because there's a reason behind the strikes. Um, so our stance as members of the DMA is that doctors have had their pay eroded. And in the same, breath, we've also had much more work. The whole world went through COVID. We watched colleagues die. We watched quite a lot of bad things happen. And it's almost like there was no appreciation of that or no proper appreciation for that. But then remove the whole concept of appreciation. We're doctors. We chose this because we love what we do. I would hope most people. Um, love what we do, and we know what we wanted to do with our lives, but at the same time, it's a vocation, it's a job. It's supposed to be a means to live a life. So if you try to think about it from a an equal, fair standpoint, it doesn't sound fair that somebody who has a huge amount of responsibility, you put yourself at risk and your family members by extension, because if you go and catch something, for example, and bring it back home, you're the one who's dealing with that. So you're exposed to that amount of risk all the time, but it doesn't seem like you are being compensated monetarily for that. And I think when you put all that together, the fact that doctors on average work more hours than the average person, the amount of training, the amount of stress, yeah, people are tired and people are saying, well, actually, if you're not going to correct anything else, at least give us pay that is, equal to the amount of training, the amount of stress, the amount of responsibility that we have to deal with. I think that's the bane of the strikes, really.
Yeah, amazing, amazing. It's really worth it, once you get paid to the kind of work you do because you're dealing with human, bodies and human lives all together. So yeah, I believe that they are really working on it, because I'm seeing a whole lot of posts about junior doctors going to strike and so many things like that. But it's gonna be fine though. So, what are some common misconceptions about mental health issues, that you've encountered in the emergency room, and how did you address them?
Ooh, very good question again. Um, so I guess in general, there is stigma attached to mental health. Um, so I obviously I'm African, and growing up in this sphere, it's a huge play where a place where if you supposedly have, let's say, a mental breakdown, you it comes with shame, not just shame for the person who is suffering, but sometimes shame for the family member. So there is that stigma attached to it. But interestingly, in the health care sector as well, you find that stigma among healthcare practitioners. And I think a lot of that stems from a lack of understanding of what a mental health patient is and the struggles that they go through. I currently work in an acute mental health setting, meaning that I deal with people who are really, really mentally unwell. So some of these people could be people that are psychotic, meaning that they have a distortion in the perception of, let's say, physical things. Maybe they've been hearing voices or seeing things that are not there, or they might have strong beliefs that are very fixed but not true. So I deal with that on a daily at work. But to a normal quote unquote medical worker who doesn't see that kind of thing, it would be very strange. It's not, because for some reason these kind of people, again, that stigma, do not come out and get accepted when you are, let's say, shouting about something, let's say aliens or whatever, something that is politically incorrect or politically sensitive, or you're saying this very strongly, um, and everybody sees you as that person that, isn't okay or isn't very okay. At the end of the day, healthcare workers are people too. So even in the healthcare sphere, there is that lack of understanding. So people, and this is doctors, nurses, healthcare workers, yeah, there's that lack of understanding. So there is that stigma attached to dealing with mental health patients, whether it's in the public or sadly in hospitals sometimes.
Amazing, amazing, amazing. Thank you so much for sharing your experience on that. So talk us through because there are all the medical students that are gonna watch this video on YouTube. So could you tell us your challenges you faced when you were in med school, your undergrad, up
Mm,
until now? Tell us what you faced, how you overcame them, and what you're facing right now, and how you're planning to alter those changes.
okay. Um, so medical school for me it was fine, but I think that was because I wanted to be a medical doctor. Um, if I see somebody who tells me they want to be a doctor, my first instinct to me would be to say, don't do it, to be honest. Don't do it because it is stressful. it is not a path that everybody can go through, unfortunately. If your reason for being a medical doctor is to, be financially stable, you're in the wrong profession. There are many other ways you could do that. So you really need to know that this is what you want to do. But I think because I always wanted to be a doctor, it was fine. It probably also helps that my mom was in the medical line as well. So I had seen somebody go through it as well. Now, when I was in medical school, it was tough because we would have tests, exams. Obviously, there's a lot of reading, stuff to do constantly. There was one particular exam that made me, really realize that this journey isn't very very easy. And that was pharmacology. And I think it's just because of the kind of person that I am and the kind of learner that I am. I failed the exam, I think, twice because I would understand mechanisms and know how things work, but I just would never remember names. I'm not the greatest person at memorizing. So that was a really, really tough time for me in medical school. But I think when I went through the preclinical years, clinical years are very nice because it was something I looked forward to. You know, that doctor bit where you're trying to diagnose and figure out what's going on. It really makes me happy doing that. Um, but yeah, medical school was a tough journey. I would not encourage anybody to go into it except you really want to. But if you want to, it's a very, very rewarding career path to take. And I guess in present time, I really love my job in psychiatry. I really enjoy emergency medicine. So I decided to take this blended approach because I realized again what I like, and I'm trying to find a path that would work for me. So if you are thinking to go into medicine, first of all, make sure it's what you want to do, and take the time to find out what you really like and do it because it is a stressful job. But if you're doing something that you're happy doing, I think it's worth it at the end.
Absolutely, absolutely, absolutely. Thank you so much for that little nuggets you added at the end of your speech. That was amazing. Thank you so much for, I'm a medical student and studying radiography, my third year, and it's really tough, not that easy. You really need to be passionate about your work as or your studies as a medical student because if you don't, you might slip off the way and you might, drop off or something. So you need to be very, very passionate about what you're doing. So thank you so much for that question answered by you, Doctor. So tell us, can you share, a particularly memorable, case, where your knowledge of both emergency medicine and psychiatric can work together to improve patient care and outcomes in the future?
So interestingly, if you work in emergency medicine, you do get exposed to quite a lot of patients that come in mentally unwell. Um, it's almost a regular thing. So in the UK, there is sadly, a high rate of patients intentionally overdosing. So this is something that you see in the ED almost all the time. Um, if you are trying to put on both hats as a psychiatry doctor and an emergency medicine doctor, your role would be, first of all, to make sure that this patient is stable. So getting a very good history, trying to understand what they've taken, if they took away any alcohol, if they're in a stable enough state for you to assess them, things like that. And then trying to, if you're taking, let's say, a mixed overdose, you need to understand what effect this is having on them. Um, know how to try and correct that if you can, and stabilize them. And then when you're done with the medical bit and they're medically fit, then you need to understand, well, why have you done this? Is there something that we can do to help you? And that's where the psychiatry team come in. So in the emergency room, actually, there is quite a lot of interplay between medicine and psychiatry, and I think it's an area that more doctors and psychiatrists need to look into blending.
Okay, so how do you keep, up with the latest technologies, used in or advancement, used in psychiatry and emergency medicine in general? How do you stay up to date?
So we do have royal colleges. And they normally would organize like conferences. And when you're in training, you have teaching as part of your training program. So there's mandatory teaching. So when you go for these, conferences or regional, teaching stuff like that, we get told what's going on. But like I guess when you were in medical school, you need to be an active learner as a doctor, as a medical practitioner. So you also need to try and actively stay up to date. So there are journals you can, get registered to. You could get the monthly publications, things like that, because these would normally give you updates on what's going on. The Royal Colleges are also really good in that they try to update you sometimes when they can. So if you stay connected to these journals, these publications, your own colleges, you would ideally get up-to-date information as it comes.
Okay. That's fine. Thank you so much for explaining that for us. So there are medical students out there, that might be depressed, including me,
Mm,
burned out, facing a whole lot of challenges. What are your advice for them? How to stay up from being burned out, being stressed out, and be encouraged, be determined enough to face that challenge they're facing. Maybe it could be an exam they're scared of or something.
mm.
So what are your advice for them?
That's a very, very good question. If you follow me on Instagram, Dr. Sophie underscore N, I try as much as I can to spread positivity, because the truth is, medicine or not, the world is such an interesting place right now that it's very easy to get stressed or depressed. I mean, we are in a global economic crisis. There's a lot that is going wrong. Um, One thing I preach is to be kind to yourself. If I guess on average you're a decent person, you probably want to be nice to the next person near you. If you see somebody struggling, you want to, lend a hand or try and ask, "Oh, are you okay? What can I do?" So if you realize that you are your first patient, if you will, you need to make sure that you are okay for you to be able to do anything else to help any other person. That would be a great standing point. So the first thing I would say is be kind to yourself. Burnout, unfortunately, is something that is rapidly on the increase. I've made quite a few videos, a few on my Instagram page as well, to help you identify when you're burnt out, to help you know what to do. But again, it's still an extension of being kind to yourself. If you feel like things are getting a bit much, or you're getting more sensitive to things that you would normally not be sensitive to, or you just, extremely stressed, you can't sleep, things are going they're not really going your way, there's a high chance that you're getting burnt out. One of the things that could help is if you try to slow down. And I know it's not always practical to slow down, but if you try to start doing little things intentionally, like pausing in the middle of a hectic day, or taking 5 minutes in the toilet, or doing practicing deep breathing, a few times a day, all these little steps can help you even when you haven't got that time. And then when you have the time, you need to take a step back and try and actually intentionally rest. That means you're not thinking about work, you're not thinking about family, you're spending time doing the things that make you happy. And slowly all these things add up. Because if you don't do that, things will only get worse. And you might get to a stage where it just looks dark and bleak and like you can't do anything else. But if you start with being kind to yourself and realizing that you are a person that should get the kindness that you give to others, try and take a breath, try and take a break and catch your breath now and then. And when you actually have that opportunity, give yourself a break. That could really help you start getting better. And I guess the one of the most important things to say is, if you feel like you're struggling, reach out to somebody. When I say somebody, I mean somebody who cares about you, your family, if they're supportive, your friends, or a professional. There's resources on the internet now, there's apps and things like that. So if you feel that you're struggling after you've done all these things, or even as you're doing all these things, reach out to somebody.
Thank you so much for that. That was a nice advice to them. When you were talking about reaching out, how do we find mentors, or how do we find supporting system that we can rely on, your own perspective, and how to, when you're feeling, I'm not going to do this anymore, I'm tired, I'm this, I'm that. So how do we find the mentor we can look upon, or finding a supporting system to, can help us thrive forward?
Hmm. I guess if I'm going to answer realistically, it can be hard because you might think, oh, you're looking up to mentors, but your mentors might be going through something similar. And some people that have gone through, chronic stress, chronic burnout might have just gotten through it day by day. So they might not be the best people to actually approach. So I guess there's an element of having to recognize when somebody actually can help you. Um, and I would imagine that's a skill that not everybody has. So you could start with somebody that seems nice, right? And I think everyone, even animals, can recognize when somebody is nice to them. Even babies know when somebody's been nice to them. So look for somebody that's nice to you, somebody that has that air of positivity, um, and just have a chat with them, right? If it's more obvious to you, if you know that person that is, everybody knows people are nice, everybody, knows that they can listen, then that would be great. If you're in the UK, and I say this because obviously I know that cultures are very different. If you're in the UK, the first place to go to would be your GP. There are also mental health crisis lines. There are resources if you just Google them. That's for those in the UK. But if you're not in a culture that has all these resources, the first place to go would be look for somebody who seems nice to you. Look for the apps on the internet. I think there's one that I've seen everywhere now called Better Health. I think there are free resources online as well. So if cost is a problem, try and look for the resources first. Try and use those around you, those that seem positive. And I guess if it's something that requires the help of a professional, then take that leap. I will put myself out there and say, you can send me a text. I will not be your shrink. I will not be your psychiatrist, but I can always speak to you and direct you to resources that could help, right? Because at the end of the day, the first person you should be able to meet should be your GP or your doctor. Actually, the preference should be your family, but family is not always the best support system. It should be your healthcare provider. So they should be the ones to direct you. But if you feel that you don't have that, reach out to me and I'll see if we can, brainstorm together and find some resources to help you.
Absolutely, absolutely. You're here to, if you have a problem, you can just, reach out to her. She's willing to really help you in some ways. And yeah, thank you so much for that. So the last question goes this way: in what ways do you believe that the fields of, emergency medicine or psychiatry medicine can work together to improve patient care, and outcomes in the future? What do you think about that?
That is I would say it seems like a question that should be a no-brainer. Like I said earlier, there is a mental health crisis, and we as humans will always, unfortunately, put ourselves at risk of danger. So emergency medicine would always be important. But at the same time, given the state of the world right now, there's a significant mental health problem. So if we are able to train more people that know how to bridge that gap, that know how to identify when actually you've come to me all the time with a headache, you've given me paracetamol, that's not helping, you don't have any, all your tests are fired, perhaps you need to, try and relax a bit more. Maybe you need to take some time off work. Maybe this is all stress induced. If we can get to a point where we're able to recognize that early and not as a last resort. And I gave headache as an example, but there are other things as well. Some people get really, really bad stomach discomfort. Some people get diarrhea. Some people get panic attacks. You think you're dying, but you're just having a panic attack, right? So if we can get to a point where we train medics, healthcare professionals to actually recognize and apply the knowledge of mental health and the way that disorders of that can show itself in the body with physical health, I think it would be very beneficial for everybody.
Thank you so much. Thank you so much for, answering all those questions and being an amazing speaker for the audience. And
Thank
thank
you
you
for
so
inviting
much
me.
for Yeah, honoring my invitation. So, what are your last words to the audience before we wrap up the session?
Well, thank you very much, first of all, for inviting me. I wasn't really sure what to expect with it, so I'm happy with the way that it turned out. I would say, first of all, I have a new Instagram channel, Dr. Sophie_N, and it's still very small, but I'm trying to spread this positivity to the world as much as I can. So follow me on Instagram if you are here. But again, I think my final word would always be kind, be kind, be kind to yourself, be kind to others. The world is a hard enough place. If you can do your bit to make it better, please do that. So be kind to yourself, be kind to others, and hopefully we'll all make it through this crazy world we live in now.
Absolutely, absolutely. Thank you so much, Doctor, for
Thank you very much.
those nuggets for the audience. So if you love this content, do well to subscribe, like, comment, and share to your network. Hopefully, someone in your network would definitely learn something of this discussion. So stay tuned for my upcoming, medical content. Yeah, thank you so much.
Thank you very much, Jonathan. All right, take care then. Bye.
Yeah, sure. Bye. Hello.